Welcome to this month's episode of I Didn't Sign Up for This. This month I have Jennifer, a mother and a professional helping other caregivers recognize the needs of their families. Jennifer had a hard time accepting her role as a caregiver and even identifying the symptoms related to dementia. You're going to want to listen to this one.
And she's not a lovey-dovey, coaxing, patting person. And she's still not. Even with dementia, everybody thinks, oh, when they get dementia, they become sweet. That's not what happened.
Does she get worse?
I think so. And then she's added anxiety and crying into it.
And she's never been a crier.
No.
Welcome to I Didn't Sign Up for This, a podcast brought to you by Alzheimer's Arkansas. I'm Carolyn, your host. We are going to dive into the complexities and challenges of being a caregiver to someone with Alzheimer's and other forms of dementia. This is just not about the disease. This is about the caregiving experiences, the challenges, the mishaps, the miscommunications, and understanding of how this disease affects families, communities, and our society as a whole. Thank you to Elder Independence Home Care for sponsoring us and underwriting to make this possible, to bring this podcast to the podcast land and you listening. Today we're speaking to Jennifer, the not so ready, I'm not really a caregiver yet. She is new in her journey, and I literally had to beg you, Jennifer, to come on today because you're at that crucial point of taking care of your loved one where people don't really realize that they're caregivers yet and really don't see maybe the diagnosis because your mother just got diagnosed, correct?
Correct.
About how long ago?
2 months.
2 months. So prior to the 2 months, did you believe your mother had dementia?
I knew we were getting there.
So she was like almost pregnant. I usually say that to people.
Well, you see signs and you see things and it makes you think and makes you wonder. And then you see more signs that make you think and make you wonder.
So is that a denial component, you think?
Well, I'm going to say no. I'm going to deny that.
But, like, looking back, do you believe that you saying, I kind of saw this? I have to put this out to the audience. Jennifer has years of experience with dementia. She's worked in hospice. She's worked in in-home care agencies. I could go on and on and on. So, with you having some professional knowledge, do you think it was a little denial in what you saw?
I will say yes to that. It was a little bit of that, and she was really good at hiding it. And I counsel people on that, but you don't know what it looks like till you're in it.
So at what point did you how did the diagnosis come to be?
She got a UTI. Same story as everybody else gets. She was not doing well. She ended up in the hospital. By the second day, she was septic and in ICU. I went to her house and started cleaning her fridge out because she had been in the hospital a couple of weeks and found things that were a little crazy, like a full can of corn that's never been opened that's still in the can in the fridge, or some milk that's really bad behind the celery that she had stuffed in the crisper because she didn't know what to do with it. I figured out she was hoarding. Every cabinet had a shelf full of food. We had 7 jars of Nutella. I don't know how much Nutella a 75-year-old woman needs, but obviously 7 jars is a max. And then we started having a lot more issues with her while she was in the hospital. And then they did not see. I kept trying to tell them that she had some.
When you say they, you mean medical staff?
Yes.
Healthcare professionals not recognizing
the signs and symptoms that she was exhibiting very clearly. That was not something you could be in denial, in my opinion. She could not tell you the date, the time, the place where she was at. She could give you her full name and her date of birth, but that was the only information that she could give for sure. for days.
So you spent a significant amount of time in the beginning of her stay advocating and trying to convince them that she had more than the touch of dementia that you
Exactly.
she had before she went in. So let's talk about the refrigerator a little bit. So from my personal knowledge of being your friend and being around you, I know that you are a present in your mother's life as well as your children. So when you had the opportunity, like you're like, I'm gonna go clean up. How did you feel knowing like there are so many things that you have missed?
It was hard. I mean, that was a big deal to me because I do this every day and I talk to other caregivers every day and tell them what they need to do. And so it was very difficult for me to see the things in there and know that it's been going on longer than that I was looking at.
So do you believe that your own experience provides you with a new face of like really what dementia looks like?
It does. I mean, it's easy to tell people the textbook things that we have learned over the years of what to do, what to say, but it's different when it's your own mom. It's different when it's your own experience. And I do use it a lot more when I'm talking to other people.
Yeah, so in that aspect, I really also want to kind of move from the refrigerator and how they kind of impacted you personally and the medical professions, because I get a lot of calls, more than I would like, from people taking care of their loved ones that say, you know, healthcare professionals don't get this, especially when you are in departments outside of geriatrics. So in the ER, in different other areas, like she had a UTI and some other things going on. How did you get them to listen to you?
I don't know that I even ever succeeded in the hospital. I mean, I worked because you get so many different people and so many different shifts. It seemed like I was repeating myself over and over. And you would get that one nurse who's super sensitive, who can, hears you and helps you a little bit. But there's some that, I mean, they just came in and out of her room so fast. She's very funny. They would ask her, can you, Miss Malcolm, can you tell me what day it is today? And she's like, no, but I didn't know what yesterday was either, so that doesn't matter. So she knew how to use her personality to get through certain situations. And so that was, it was, I'm not going to say entertaining, but it kept them from understanding what I was saying. It kept them from seeing some of the things that I was saying because she would make smart little remarks and they thought she was cute and they would just move.
Or I guess like the mean old lady kind of thing that we kind of put on ageism, and people like, she's just being mean and ornery, when this her coping skill of how to deal with what she does not know.
Exactly.
So we're going to fast forward. She goes from the hospital to rehab. And we're going to talk about some of the stuff you didn't sign up for. So did you sign up to be a caregiver in this sense? Did you ever imagine like this is what caregiving is going to look like for you?
No. And I'm an only child, so I don't have a choice. This is it.
And your support system are your children, correct?
Yeah.
So being in the profession, tell me how you see, like we talk about this all the time, especially how you deal with like her behaviors, her coping skills. We'll say her mouth, because she's kind of mouthy, is she not?
She's a lot. Yes.
So how do you personally deal with like the frustration, like, because it's there, right?
Well, I don't do it like you're supposed to.
Okay.
I don't go into the way that we tell other people to do it because it's your mom, and I assume that at 1 minute, I might catch her when she'll understand me. So I'm always continually trying to reason with her. And you can't. I know.
You can't. I know. So you can't reason, but you continue to do it anyway. And I don't fault you for, because this is a skill that you have to learn to do. And it's going to be 1 minute that you recognize, you click and you're like, this is not working. But until that happens.
Right.
the frustration you have with, because you still deal with, and I'll use for a lack of a better term at this, like the mom, the past mom, and not the present mom. Do you think that's true?
It is, because I've always had to reason with her on things, because my mom is it's her way or the wrong way. I mean, you're not even her way or another way. It's her way or you're wrong. And so it's always, if I wanted my case to be heard, I always had to reason it out to make her understand my side. So I have been trained my whole life to reason with her. I mean, that's just how our relationship works. So it's very difficult for me to undo my entire life, years of training of how to talk to her. And she's not a lovey-dovey, coaxing, patting person, and she's still not. Even with dementia, everybody thinks, oh, when they get dementia, they become sweet. That's not what happened.
Does she get worse?
I think so. You do. And then she's added anxiety and crying into it.
And she's never been a crier.
No.
So I can just see the frustration right now, like how you breathe. No, she did. So, and I don't think you handle crying very well.
No, I'm not a compassionate person either. I grew up with a mom who's, not that way. And so I'm not that person. When my kids cried, are you bleeding? Is there a bone sticking out? Do you need emergency care? Then you'll be fine. And so that's how I was raised. That's how I raised my kids. And so my kids are the same way too. Nana, are you bleeding? Are you dying? Then you'll be okay. And that's not how it works.
It's not how it works.
Right now.
So you have so how are your kids handled? Because they didn't sign up for this either, right?
No, they didn't. They do okay. They get frustrated with her. She tends to call us all 6 and 7. Like if she thinks in her head she needs to call us, she keeps calling until somebody answers. But we all 3 have jobs where you can't answer, so they get a little frustrated when they have 6 missed calls from her. My youngest had to go over today because she had a noise coming from her smoke detector, and she had plans today, and she was going to the zoo with some friends, and then she had to go to work, but she had to take time out of her day, and she was a little frustrated with me.
Had to cover. Another part of this experience, and our didn't sign up for this, is when her brother, your uncle, right? A lot of stuff you have to make decisions on, like changing. What he told you, it was yours?
It was not my responsibility.
It was not
to take her keys.
Not yours. So her brother, is he older or younger?
He's 3 years younger. This is his older sister who makes all, decisions.
And in a family where there's usually like some mutual respect, and you like, that's your uncle and they're the elder, he's told you it is not your responsibility. Right. So does he have a plan?
No, I asked that. We had a talk about what he thought we should do and and he just doesn't think she's that bad yet. And we had her birthday party. She turned 75 this year. We had her birthday party. My uncle, his kids, all their families were there. And they continually mentioned how I have been exaggerating and she's not near as bad as they thought. There was nothing going on. They don't see anything wrong the whole time. And I mean, what do you do?
So there's a term called show timing that I think that people have phrased in dementia, where the person with dementia show times, and it's kind of like they're on their best behavior, and if you don't dig deep, you just don't see it. So convincing family members, despite she does have a diagnosis, correct? Yes. She has had issues because one day, let's talk about him spending time with her. And I think they went out to eat, didn't they?
He actually met me at the hospital when she was getting out of the hospital. He met me, and he was supposed to take her home, and I was supposed to go to the pharmacy and get her meds. That was our plan, and because he was helping me out. And so she wanted something to eat. As soon as they left the hospital, she wanted something to eat. So he let her pick where to go, and because he's that, whatever she wants. And she picked a place that was in the same parking lot as the pharmacy, because I'm at Sam's Pharmacy, and there's the same restaurant across town 3 blocks from her house. And she talked him into going to this other one because she remembered the directions to that one,
and not the one
closest to her house. And when I mentioned it, and he said, but she knew exactly how to get there. She didn't get lost. But did she tell you there was one 2 or 3 blocks from her house? And he's like, no, I didn't know that. really? So she didn't remember everything, but he said, you can't take her keys. She totally knew where she was going.
So let's talk about the cure. Your mom is here. So
Yes.
I get this question all the time. Do they know? Are they aware? They won't accept that they have, dementia. So let's talk about her mom being cured.
So she, after we got her diagnosis, because we did her, was at the MRI, she has significant gray matter. This was the doctor's words. And then he put her on one of the meds and put her on the lowest dose, like a 5 milligrams, whatever. And she kept telling me it's helping a lot. So we go back to the doctor, and this is a month later. He wants to do a month follow-up. And he said, how's it going? She's like, I am cured. This is the miracle drug. It is perfect. She's like, I had a complete sentence today and didn't even have to think for one of the words. And he's like, one complete sentence today. And she's like, yes, that's so much better. And he said, well, we're going to double it. Yes. I don't think one sentence is what we actually were looking for. But yes, she's pretty convinced that she's cured. She feels much better, and she doesn't have dementia anymore.
So her awareness, so this is for education and out here in podcast, Leah. Her awareness that she has dementia is at what level, you would say?
Well, she knows that she had it, and it was significant, but now it's not dementia, it's just a little memory loss. She just can't use some of her words.
So answering people's question is, it's not feasible always for people to know. And even when they know, they don't really know. For a lot of them, they know something's wrong, but they don't know. And you can't tell them that something is wrong, because let's think about the argument. I'm pretty sure you didn't tell her she has it still, did you?
No.
Okay. So
No, I didn't even rationalize.
Did you rationalize?
I just said, okay.
So you just said, okay. But the reality is in that that she does, which has changed your life even in the beginning stages. So what would you say to those people who are looking at their loved ones, whomever the relationship, and say, I think something's going on? What advice?
Well, you have to be accepting, but you have to get some help, because her diagnosis was harder than I thought to get, because she could put on a show. And so that was the one thing I asked rehab was, please document the thing, because they figured it out at rehab more, because they were trying to teach her to do things she could not
comprehend.
Yeah, she could not do it. And so you need documentation. You need that initial exam to see where you're at. Go ahead and figure out. I kept telling her, let's go to the doctor and let's just get a baseline. And when I knew something was wrong before, I kept saying, let's just go get a baseline. Let's just go see where we're at today. And then in a year, we can go back and just see how we've progressed. So that, to me, that is the smartest thing to do. Go ahead and get that baseline. Go ahead and go and do whatever you can proactively before they start having the anxiety and the crying and the stress, and before you start having the crying and anxiety and the stress.
Because there's some key things to do, like get a power of attorney.
Yes.
That has to be done. It needs to be done way before a diagnosis. I say at 18, we all need a power of attorney to make decisions, because something can happen to any of us.
And we did get a power of attorney for some unforeseen reason before she went in the hospital. I had been talking to her about it a lot. I mean, and she's very, very, very independent. And she does not want to go in a nursing home. We actually have sticky notes all over the house, on her mirrors, on the cabinets, that say, I will not go in a nursing home. I don't know if she's worried that she'll forget it, or I will. I don't know. But it's there.
A reminder.
It is there. But she wants her own independence. So that to her, the power of attorney was not an independent thing to do. And so I had to really work with her about, I can't have a say until you can't. And it took having her friends back me up. So I had to call in.
Can you call them the troops?
I had to call in some friends and just be like, hey, I need you on my side. They helped me maneuver that. So sometimes you have to call in a couple of favors to get somebody on your side.
Also, let's talk about caregiving? Like, I say you're not so caregiver. Like, I don't know where you, or even if you have, like, came to terms that you're truly a caregiver yet. Have you came to terms with that yet?
I have. I have taken care of my mom off and on for years. She's had a lot of mental instabilities over her life, and so I've always. I took care of my grandmother. My dad was sick for over a year. I am a caregiver. I have been.
But I think one part of her was like, because she felt so independent,
Yes.
you kind of was like, oh, I'm helping her out right now. I'm not really.
And she won't let me. If I even said I was a caregiver, she would come unglued. That's not okay for her. I mean, I have to pay her bills for her, and she's very upset about that. I mean, I have to help her sometimes with her meals. She's having a hard time figuring out recipes that she used to eat all the time that I grew up on. She can't remember how to make things, so she has to call me, and boy, it really makes her mad when I have to tell her something. And so her independence, where I'm concerned, she's very worried to show me her weakness because she doesn't want to go in a nursing home, because she doesn't want me to be her caregiver, because she doesn't want to give up her independence. And I don't blame her, because her ability to be independent is what's kept her going as long as she has.
And I just have this notion that for all of us, we fought to be independent from, when we're a baby to like we grow. We want to tie our own shoes. We want to drive. All those things, get a job, have our own place. All of those things are what we fought and earned to become independent, and slowly it's being taken away from her. Mm-hmm. And the best way to show that you have independence in a lot of ways is going against the grain, saying no, being in conflict to show that, like, I don't have to say whatever you want me to do. So what's your caregiving plan?
Well, I'm just a day at a time doing it right now, Carolyn. I have to do whatever she lets me do. Mm-hmm. Now, do I know I've talked to the doctor a little bit about the key situation about the car. When is she ready? We've talked about, her not using her stove as much. I mean, I've already introduced her to the idea that there are pharmacies that will deliver. We've taught, you have to and I know she doesn't always remember, but I have to keep reminding her there are options that are not going to take her independence. It's all in how you present it. Unfortunately, even with dementia or not, I can't hurt her feelings because she shuts down and I can't say.
And I always say, consider when we're starting to caregive for our loved ones, is like when we take something away, try to give something back. Mm-hmm. That's a hard thing to do. So like with the car situation, whenever it comes to the point you have to take the car, like, how is she going to get around? Who is going to take her? Who's going to give up time? And is there a way to get her places? Because it is a memory issue, and like it can cause a lot of issues. So you just can't put her in an Uber, or you can't get the bus, like transportation to come get her. Because, a lot of cities do have like elderly transportation from door to door. But with that type of impairment, you can't do those things either. So giving her something becomes really thoughtful. But for the caregiving part for you, because you've already been quite frustrated in the beginning. So, like, what is your take care of yourself plan in all of this? Where are you going to take care of yourself?
Well, I hadn't thought about me. Leah, which is my oldest daughter, is my caregiver at heart. I mean, anybody who has more than one child knows I have 3 kids, 3 different personalities. She is my middle child. She is my caregiver. She knows if you need, I can look at somebody and be like, oh, they look like they're having a rough day. Leah looks at them. They're like, can I get you an aspirin? Can I get you some water? She just knows instantly what you need. And so she is our plan. She's the one that takes care of me a lot right now. And then she's the one that probably will move in with my mom and be her support to take her places and plan the things to take her. Because Mom, she likes to know what days she can get her hair done and what days, so she can plan on her days off. So we do have that plan. Okay. For me, I don't have a lot of plans. I again, I just am dealing with this day by day. I didn't plan for this.
You didn't sign up.
I didn't sign up for this.
Yeah.
No.
So, and like our whole conversation of, yes, we know that our loved ones, our parents are going to get older, but we don't see caregiving like in this aspect, right?
Right.
And I guess we don't see them being so combative and resistant to everything. So learning where our power lies and becoming a little bit more compassionate to the loss of their independence. So let's kind of wrap up I didn't sign up for this a little bit. So you didn't sign up to be your mother's caregiver like this early, right?
Right.
Because I think also we don't realize how early they need us. So you kind of think that a little bit?
Yes, because you have in your mind that when they get feeble and, are bedridden, then they need you. When they're on, those last few whatever years or, that when you just expect them to be, I don't know, you just have in your head what you think your parent will look like when they...
And you having a very independent, like I take care of myself, mother. You never really saw her in this point. And she's really physically healthy.
Mm-hmm.
She's very healthy. So she moves around now.
She does, and she's very impulsive, which I know is part of it, but she's very impulsive. Like if she wants to go get her hair done, she wants to get her hair done like right now. She doesn't want to plan, okay, Mom, I can take off Friday afternoon and I can take you to get your hair done. No, if she wants her hair done on Tuesday, she's getting her hair done on Tuesday. It doesn't matter where she has to go, what she has to do.
Oh, she got to drive around until you...
Yes, she does. So there's no rhyme or reason to whenever she decides. I talk to her every morning on my way to work. That's our thing, to make sure she's okay, see how her day is, make her feel adjusted, loved, cared about every day. Yesterday, she needed to go pick up prescriptions at Sam's that opens at 10:30. It was 9 o'clock in the morning. She couldn't talk to me because she had to get ready to go to Sam's. That's all she could focus on. And I'm like, well, tell me what else you're going to do today. I can't. I've got to get ready. And so that was the end of the conversation. It's one thing that, and she focuses on.
So families out here that are listening, I want you to really listen to Jennifer and her story, because there are probably so many people out there who kind of think something's wrong. And I always say, if something is wrong, something is wrong. Now, I'm not going to tell you that it's dementia, but when you see something, something's wrong. When there's a change, there is something wrong. It is better for some things that you go ahead and really like try to get the diagnosis. I really keep saying I'm gonna wrap this up, but you also had a hard time with her feeling for this, just because he had a relationship with her too, right?
Yes. So he has been our doctor since I was 13 years old. I mean, and they actually had some college classes together because she went to college late. And he's about to retire, but he is very close with her, and he did not want to upset her. And when he had to tell her that she had dementia, he almost cried. I mean, and he did not want to tell her he couldn't take the keys. He didn't want to, and he was like, do you need a second opinion? Do you want me to send you somewhere else? Do you need something else? He was it upset him, I think, more than it did me.
Yeah.
That he has.
You already.
Yeah, that's what I told him. I was like, you are the second opinion. I mean, I got to already figure this out. But he had a hard time. He did not want to tell her that she couldn't do something. He kept putting it off, saying, well, we'll discuss that next time. And so that's where we're at with the driving. We'll discuss that next time.
So just education. Like, it is not as easy to get the diagnosis as you think it is. Mm-hmm. Even your primary care doctor, if you have they're people too. So they can not see all the signs, symptoms, and they don't want to do it. Healthcare professionals,
they don't see it.
They don't see, if they don't have knowledge and training.
The rehab was the best part because, like I said, in the hospital, it was different people, different shifts, different timing of the day, different things. In rehab, it was the same person with her every day for her 3 hours of rehab that she was doing. And they really saw when they asked her to step up steps and then step back down, she could not make that distinction. They asked her what her one goal was, and she said to do her own money, not to have me pay her bills. So they asked her to make change for a 20, and she could not. So that was a big help for me because they recognize those things. And I asked them, I said, I know this sounds terrible, but I need you to document. I need all that heavily documented. And that's what I took to the doctor and was like, look, you're going to have to help me because here's why.
So I want to thank you for being a guest on I Didn't Sign Up for This. And you didn't sign up for coming to the podcast either. And I want to thank you for getting out of your comfort zone so you can share your story. And I can't wait because it's like down the road. I know you got to come back because there's going to be some other things that you didn't sign up for and understanding. I know we all have day by day, moment by moment. And I just want to hear how especially your self-care plan kind of leads out and how your mother is going to accept like someone moving in and all the other steps. So I think we'll hear you down the road just a little bit, give you a little bit of time to get over this one. So I want to thank you for joining us today and sharing your family's story. A special thanks to Jennifer for sharing her family's intimate insight to caring for her mother, despite her knowledge or acceptance that she has dementia. Subscribe, review, and share this podcast. Thank you to Elder Independence for underwriting. I did not sign up for this. Until next time.